Amazing. Thanks everyone for being here today. Appreciate y'all coming out this morning. Enjoy your oatmeal, enjoy your breakfast. Please feel free to do so. Excited to be with y'all to talk about language access in healthcare. So it's something that I've heard a lot as we've been having these discussions. We've been talking, there's been sessions about bias, and I wanted to hone in today on specifically language access. So our title here is Beyond the Care Team, Advancing Patient Equity Through Hospital-Wide Language Accessibility. So as a quick intro, I did already say hello to a couple of y'all this morning, but my name is Katie, and I'm our head of marketing at Pocket Talk. I am a former educator, like I had just mentioned, and currently my role, I worked in bilingual education, so I got to work in a dual immersion Spanish class. So I spent about 60% of my time in Spanish and working with a lot of families who needed support on the language side as well. And so I've always been a really passionate advocate for language access. And now within my role at Pocket Talk, I get to meet with fantastic healthcare providers such as yourselves, educators around the world, and even government officials to inform them and educate them on aspects of language access and promoting language equity. So that's something that I'm really passionate about, and thanks so much for being here again. Excited to chat with y'all about it today. So as far as our agenda goes this morning, I want to share, first of all, the impacts of language barriers in healthcare and how they're affecting our LAP patients. I also want to talk beyond the clinical conversations. So not just within the physician and patient relationship, but exploring all of those touch points along the patient's journey that don't have language supports. And thinking through some of our existing solutions and how the challenges that we might be exploring with them, as well as introducing some new technologies. So we'll come back to this agenda at the end, and I'll have a couple of takeaways for y'all. But this is our agenda and our learning objectives for the day. So as we're getting started, show of hands, who feels that patients should be able to communicate in the language that they feel most comfortable in? 100%. Yeah, all of us. I mean, that was a really easy one. And as we look around, we see everyone is in agreement. However, we know the realities are not such. People are not pulling in the language line. They're not pulling in professional interpreters for a variety of reasons. And sometimes it's, limited access. Sometimes they can't find that iPad cart. Where is that? What floor is it on? Sometimes they want to make sure they have a specific and personal connection with that patient, and bringing in a third person and a third party just feels like it might be a barrier to that connection that they might be able to have. But like we were talking about, it could be also a lack of confidence in the interpreter's skills. I was chatting with someone this morning about bias in interpretation as well. We need an exact translation, but sometimes interpreters will have a patient speak for 5 minutes, and then they'll turn around and say one sentence, and you're like, wait a second, this doesn't really line up here. So there's a variety of reasons, and in 2019 there was a study from Mount Sinai, and they mentioned that over 90% of providers are reporting that they defer getting a formal interpretation at some time. Over 90%. So we realize that despite the fact all of us are raising our hands, we definitely want patients to be able to communicate in the language they feel comfortable in. The realities are that it's not happening. So with that, let's back up a little bit and talk about limited English proficiency. So according to the US Census, 8% of our population is LAP. And for those of us who are working in very urban areas, that percentage might be as high as 15 to 20% of our population prefers to speak another language. So with that, it's a huge amount of people within our population that we're not able to support. And there are tons of barriers about that. I had mentioned the bias presentation that was happening in the Sunset Room yesterday afternoon. That one was really enlightening too, because they talked so much about all of these different disparities that patients can experience, and not just LAP patients, but patients of all different backgrounds. But when we think about specifically LAP patients, there's increased safety risks, higher costs of healthcare, higher readmission rates, and implicit and explicit bias, which again, we had talked about a little bit and heard about a little bit yesterday. Within this chart here, I have a visual of the percentages of the population who are feeling like they're heard by their physician. And if we look at the trends, no matter what the trends are, when we see the limited English proficient, which is that red line down at the bottom, no matter how it's trending, it is always significantly lower than the English proficient patients. So being not unable to communicate and express and advocate for their own well-being is making these patients feel like they're not heard by their providers. Additionally, there are other healthcare barriers that are impacting them, which is suboptimal patient and physician relationships. And we also have heard a lot about lower patient satisfaction rates. So when we're thinking about a patient inside of, in a conversation, if they're not feeling that trust with their physician, there's a lot of research that backs, if they're not feeling that trust, they will not continue to follow that post-care procedure, all of the post-care instructions that they've been given. And because of that, readmission rates are a lot higher. So we've seen a lot of correlation with that. So it's not just, these challenges are not just impacting our patients, it's also impacting our hospitals. There's increased liability, there are compliance concerns, as well as financial costs related to not being able to support our LAP patients. So, but despite all of this, all of these challenges and all these barriers that we've been talking about, every single one of these barriers I've just discussed has only been about this part, just the part where the patient is meeting with the physician. But the reality is when we think about a limited English proficient patient and their journey throughout from entry to exit, there are so many more touch points that are happening that language access is not being supported. So if you think about those barriers and then expand it across all of these elements and all of these touch points, we're seeing that there's a ton of disparities that are impacting our LAP patients. From the moment they step into a healthcare provider's office, all the way to the end, they are interacting with dozens of different people. That's even down to like billing, right as they're entering into the hospital, even parking. All of that is impacting their patient experience, and all of that requires supports from a language perspective. And these are not clinical conversations either. These are staff members that just don't have access to the language line, or they don't have access to other language supports. There was a real life example of a Vietnamese speaking family. It was during a joint commission audit, and it was during food services. So the patient was communicating in Vietnamese that they had a dietary restriction, and because there was no language line available and they weren't pulling in that interpreter, there was just a lot of gesturing happening, and the Joint Commission had to step in and say, this is a moment right here where it could have been a very serious consequence, but, and again, not within a clinical setting, but it could have still had a very serious consequence. So these are the reasons why we have to have language supports in every single one of these. And again, these aren't medical mistakes. These aren't our traditional, when we're thinking just about the care team, medical conversations, but they are communication failures that would really have impacted and created a serious consequence. So again, equitable care means communicating across languages at every single step. Again, from entry all the way to exit. And making sure like even our security teams have the ability to be able to communicate across languages. We've been hearing a lot of examples of like really serious conversations happening across hospitals, particularly with this climate right now. There's been a lot of conversations, and making sure that security teams have access to communicate with every single person on staff. Being prepared for unexpected conversations on the fly. My colleague, who is our healthcare sales rep, he's been speaking with a lot of hospitals as well who've been demoing our devices and understanding more about how you can incorporate machine translation. And they mentioned this one story of a Hmong-speaking mom in the pediatrics unit. And she was very distraught, and the staff were not able to communicate with her. They weren't sure what was wrong. And it took them 20, 30 minutes to like find an interpreter, be able to call in that language line, wait on hold. By the time they finished that communication, they realized all she wanted was to bring her sister into the room with them. That's it. But because of that lack of communication and because of that lack of like immediacy, they had to delay that conversation for so long. And a lot of the times these conversations need to happen in a split second. When we're thinking about the emergency departments bringing someone in, being able to immediately communicate with them. So again, these are all of these touch points that may or may not have access to language supports, But we also know the reality is they may not be using them. And at this point, it's not just about patient comfort. It's about patient safety, it's about compliance, and it's about equity. So I've been mentioning that language line a lot. Y'all are all familiar with the iPad cart. I'm seeing some nodding, and I'm also hearing, I've heard from some sessions in these last couple of days, but also with the healthcare providers that I've worked with, the realities are that this is a bit of a challenge. I've heard, again, like I mentioned earlier, where is that iPad? What floor is it on? Once I get to it, it may not have the dialect that I'm looking for. Then I'm waiting on hold, and just so y'all know, the hospitals are also paying for every minute that you're on hold too. And then once you get connected to somebody, the call drops. There's all of these reasons that might be impacting why you're not using this. But if you notice, as I'm talking about this hierarchy of language translations, it's at the top, and it's going to stay on all of these slides. But without that, when we're thinking about all those different touch points, without that, at the very basic level, is what we're using is gestures. I've been chatting with some nurses, and they had mentioned that when they notice someone's who doesn't speak English, they are an LAP patient, and they don't want to bother with pulling in that cart again. It's pretty standard procedure. They're like, hey, I'm coming in, I'm going to check your blood pressure. My name is Katie, I'm going to be your nurse this evening. How's your pain level? Good, bad. There's a lot of gesturing happening, and how much communication is happening, we're not sure. But we know that basic gestures are definitely something that people are using when these touch points don't have language line. And again, if we're thinking outside of the care team, at parking, at food services, at entry, there's a lot of gesturing happening. Above that is untrained bystanders and reluctant or inexperienced helpers. So in that case, we're thinking another patient who speaks this language. Hey, does anyone speak Hmong? I need a quick conversation here. Or could be a child potentially making this translation, which we have heard a lot of real life examples of as well. And we know that certain states are now starting to crack down in a medical setting and where there are legal protections for the children to not be translating in medical settings. But we also know that that is happening, where we're pulling in reluctant and inexperienced helpers, some bystanders to support with language translations. And what I would love to chat about today, too, is the technology-powered solutions. So that's another part of our hierarchy of language translations, where technology-powered solutions are coming out. There's a lot of hype and a lot of discussion around AI translation. What does that mean? But it is something that can support routine administrative conversations. So these conversations, again, that are not clinical, but are going to be standard procedure. For example, in radiology, every single time that conversation is almost exactly the same. Hi, welcome in, please take off any metals. There's going to be a loud noise. This is all completely normal. And we know, as I've heard from a couple of radiology teams that we've been working with, again, they're just back to gesturing, and then they're showing, and they're just saying the exact same thing, so they're not really pulling in that language line. But being able to have machine translation, it can take over the basic gestures. It can take over the untrained bystander and reluctant and inexperienced helpers. But at the end, it's still collaborating with, at the very top, our professional human interpreters. So again, pulling in and replacing those gestures, but those human interpreters will always be essential to any one of these healthcare conversations. Because at the end of the day, when you're having a really serious medical conversation, you're giving a diagnosis. These are conversations that you don't want to pull in like a $350 device to have this conversation. You want to make sure there is interpreter background, this person has medical knowledge, they're able to deliver this news with a level of empathy, and you're not just having this little AI-generated voice talking for you in a really serious conversation. But those other conversations, like at triage, hey, what's happening? What kind of pain are you experiencing, level 1 to 10? Those kind of conversations at radiologies, again, loud noises. There's going to be a loud beeping noise. Please remove any metals. All of those pieces are they're not clinical, and they are administrative conversations that would be able to be utilized in this case. So again, we're accelerating the patient journey by augmenting our resources and the supports that we have, not replacing. So I think a lot of the times when people talk about machine translation, they're like, oh, no, we can't replace the language line. And the truth is we don't want to replace the language line. We want to make sure we're working in collaboration with them. Now, some of y'all might be thinking, there's that hesitancy. I know there's like a little bit of the fear of the unknown. AI's become a really big buzzword for everyone. What does that really mean? How do I make sure that this is something that I can trust? How do I make sure that I'm vetting this solution to best support my patients? So there are some questions, because we all know we all have Google Translate in our pockets, and we know that Google Translate is not HIPAA certified, but we all know that the reality is some of us are using Google Translate. So how can we make sure we're protecting our patients' data and making sure we know what questions we need to ask? So the first thing, again, giving yourself peace of mind, making sure that you're making informed decisions. Some questions you might want to ask yourself before introducing a handheld translator or an AI-powered translator to your organization is, of course, the very basic is security. Security is the most important part. Does this device comply with data privacy standards? Does this device comply with HIPAA, GDPR, ISO standards, all related to privacy, whether that's specific to patient privacy or just general data privacy? Are the translation histories visible, potentially exposing data to anybody? If you're having a conversation with one patient in one room, and then you bring the device over to another room, can that second patient now read all of your previous conversations? Are these translations, and can they be shared externally without proper controls? Can any one of our staff members just download all those important, really sensitive conversations and then share it via email to anybody? And if a device goes missing or is lost, can it be remotely deactivated to protect that data? Because all of these questions are things to think about, because I don't want us to be afraid of new things. I don't want us to be afraid of trying new things and introducing new tools that we know will be helpful for all of our patients. But there are questions that we can ask to make these informed decisions. Another section is there are a lot, if you go on Amazon and you type in translation device, there are a ton, hundreds of gadgets, translation device gadgets for travelers. Mainly it's like, imagine you're traveling to Europe for the summer. Here is this translation device. You could plug it into your ears. But are they designed for bulk management? So that's another thing to think about. Despite the fact that there are all these gadgets, what is going to be useful for me, for your IT teams? Can they be efficiently set up in bulk? Can they be used to control securely and connectivity settings remotely? Can you bulk set up Wi-Fi? Can you change all of the settings? Can you turn the cameras off? There's a lot of systems and settings, and in these gadgets, there's just not a lot of management available. So a couple of questions to ask before in order for you to open yourself up, because at the end of the day, if we can imagine creating a space where every single one of these touch points has language support available, beyond gestures, beyond grabbing in like a bystander, and every single one of these touch points has some sort of language support that's immediately available and people can immediately have this conversation. Imagine the results of that. We will have improved patient trust and their satisfaction scores supporting the hospital. We'll have lower readmission rates, more efficient consultations and workflows. So every check-in, every meal, every safety concern supported with real-time language access. And again, this impact goes beyond just that patient-physician conversation and that patient-physician relationship, because studies show that when patients can communicate freely at any time and advocate for themselves, satisfaction scores are rising, readmission rates are dropping, and healthcare teams just work more efficiently. So I wanted to share too, we've got a couple of organizations that are currently using our devices, and one of them is based in the UK. This is an organization of about 8 healthcare organizations in the UK. So eight buildings, and they see about 45,000 patients altogether. 13% of these patients are LEP patients, and we deployed our devices at the front desk, we deployed them at the pharmacy for non-clinical conversations, and we also deployed them for nurse consultations. This is over the course of 5 months. Over 12 hours of interpretation later, we polled the staff to see how they felt about utilizing these devices, and we also polled the patients. And what we saw, and we all know whenever we're looking at research, we all know how rare it is to get 100%, so I wanted to throw both of these on here. 100% of the patients who used Pocket Talk trusted it enough to use it again. They felt like they were comfortable using this device, they felt like it was safe, and 100% of the staff agreed that using Pocket Talk was a safe way to help me communicate with my patient. So we know that we have examples of these organizations, and there are surgeries study. We have examples of people utilizing these devices, and they are feeling trustworthy of it. A couple of weeks ago, there was a quote from the Mayo Clinic CEO specifically about AI. And they mentioned, we cannot let our fear of the unknown stop us from doing what's best for our patients. We need to get this right. And I feel that despite that fear and anxiety around the unknown of translation devices and AI, there are those questions that you can ask yourself to make sure you're making informed decisions. So again, this enhanced customer service as well, and it also just reinforces that equitable care means communicating across languages at every single step and not just in the exam room. So with that, just reiterating our agenda and our learning objectives today, this morning we chatted about the challenges that are facing our LAP patients and how language gaps are affecting their health outcomes. And then we talked beyond the clinical care setting, beyond that physician and patient relationship, to see all of those variety of touch points that our LAP patients are experiencing and making sure that we have supports available for them. We compared some of our existing solutions from, again, human interpreters to phone interpreters to pulling in random bystanders to talking about machine translation and introducing some of these additional innovative technologies that exist. And then I also shared with y'all some questions to ask before you introduce these types of devices into your organization. In the back there on that small table, I've got 2 sheets. One of them is talking all about Pocket Talk, and one of them is specifically about those questions to ask. Even if you don't end up choosing Pocket Talk, these are the questions that you should really be thinking about before you start introducing these types of technologies and devices with your organization. Although I will say, from my professional opinion, that there are no other devices out there that are as secure as we are. That's the whole basis of what we do and what we believe in is security. And we do work within additional industries, our main one being education and healthcare. So imagine like newcomer students coming into schools and their families, as well as within healthcare, and additionally government and public safety. So all to say, if y'all have any questions at all about general machine translation or specifically about Pocket Talk and how we can support your hospital organization, please feel free to let me know. But thank you all so much for being here this morning. I really appreciate it. And I'd love to open it up for some questions. I'll also be here if you have additional conversations that you'd like to have. But thank y'all so much. Appreciate it. Please.
On your last slide with 100%, what was your end for that? How many patients and how many staff members?
Yeah. I've got they had like created these really beautiful PDFs. If I can get your card, I can send that out to you. Or I know that they scanned y'all in today. I can share this presentation and then link the study. Actually, if I go back, I did link it in this underlined part. So when I share out the slides to you all, for those in attendance, you can click on it and explore a little bit more. But I did get all this info from our UK team, and I wasn't personally involved in that one, but that's a great question. Yeah, any other questions? And the question again for the recording, which I totally forgot, was what was the N? Jeff's laughing back there. What was the N for the number of patients and then the number of staff polled? That's a great question. Any? Do you have an example? Oh yeah, I actually was supposed to do this really cool last translation and do this really awesome as a part of my presentation, just like wrap it up with this really great translation, but I forgot. Espero que podemos trabajar juntos para eliminar todas las barreras lingüísticas.
I hope we can work together to eliminate all language barriers.
Just like that. All you have to do is press the button and immediately start translating. It's really, really quick. And happy to give more demos too, but I mean, y'all are all sitting here so patiently so I can continue demoing. We've got all you have to do is press on the button, and then you've got tons of languages. Within Spanish specifically, we've got 7 different dialects of Spanish, depending on the country that they're coming from, supporting with accents. Yes, ma'am.
Hi, so as a nurse, I see that cute little device. How am I going to keep it safe?
How am I going to keep it safe?
Because it will
Do you mean it'll grow legs and walk away? Yeah, we've heard that a lot too. Yeah. Yeah, absolutely. That's a question that we've gotten before too. And we have these lanyards. What we've seen is within some hospital systems, they will check in a device basically for an LAP patient. And as they are walking around the hospital, with every single touch point, they just wear this around their necks, and then they can utilize it at every single touch point. And upon exit, they return them. Alternatively, we have seen them in each exam room. But again, I feel like that kind of goes against my presentation here. It's only in the exam rooms, but they do have them on the exam room within like attached to the wall or something, and then they can pull it out and then kind of pop it right back in. Or a lot of the times people are just wearing, healthcare providers are just wearing them on their bodies, and then we've got those fun little lanyards that you can pull out. But as far as the walking legs and disappearing, that's a reality for any one of these devices. A lot of the times that just happens. And I think that goes back to the question of, can you do something about that? If it walks away and it's gone, can you wipe it? Can you deactivate it? Can you make sure that it's not being utilized anymore and no one can go into it and take out all the information and find all the translation histories and whatever the case may be? Yeah.
I love this. That's why I'm asking so many questions. To her point, I mean, usually our clinical engineering department can put some type of tracker on it.
Mm-hmm.
Do you have something, or is that something you would expect the institution to do?
I think that most of the time we've been seeing people are buying a case and sticking one of those trackers on it. How they have those air tag type things.
Yeah.
That is something I think that most of the facilities are doing themselves.
Because
But I'll say our product team has definitely been hounded a couple times, like, hey, can we get some location trackers on there? We've definitely heard it before. Yeah.
Things get lost all the time. You would be shocked probably. The other thing is, how do you clean it?
How do you clean it?
Wipe it?
Yeah, I'm not supposed to share the organizations that are currently trialing it, but a big healthcare provider organization is currently taking some of our devices through a brutal test where they're hitting it with, dunking it in hand sanitizer and Clorox wiping and everything. And so far we're passing with flying colors. The whole thing, you can just take it out, disinfect it with Clorox, again, kind of dunk it in hand sanitizer, and it's good to go. And that's how you clean it. And that, again, I forgot to repeat the question. Yeah, absolutely.
So charging, holds a good charge,
Holds a good charge, yeah. I think the specific stats are it can sit here for 190 hours or something like that, well over a workday. And if you're continuously translating, it'll translate for, I think, 5 or 6 hours. Just if I was sitting here translating for 6 straight hours, the battery life would still continue. So the general consensus is it lasts about as long as your phone does. Yeah, and then yes. Oh, good to see you again. Great question. Yeah, this guy right out of the box comes with its own data. So it has its own data plan, so you can utilize it right out of the box. It's for 5 years. But beyond that, it can also connect to Wi-Fi. So a lot of the times within hospital systems specifically, the IT teams want it to be connected to your enterprise Wi-Fi. And again, that's back to that bulk management setup system. You can, if you bought 50 or 100 devices, you don't want your IT team to be sitting there typing in that Wi-Fi password 100 times. So it can set up to your Wi-Fi system, and then even after that expiration of that 5 years SIM card inside expires, you can continue to use it on Wi-Fi forever. It does, yes. If that was the specific question, it does require connection to translate. So it either has to be connected to Wi-Fi or within the data that's inside. It has 84 languages, and we always write 84 plus, because if you include all the dialects, because we're counting Spanish as one language, but if you included all the dialects, it's over 160 or something like that, because it has a lot of variety of dialects in here. And if you can imagine, every time we've gone to conferences or had conversations with folks, there's always someone who's like, let me come over here, I bet you can't do my language, and then they test it out, and they're like, wow. We had a person who was visiting from Egypt to one of our nurses conferences. If any of y'all attend ANCC, we were at that conference, and they came up and they were like, I'm going to try various dialects from around my region, and I'm going to see if your device can do it. And he was blown away. He was genuinely like, wow, I said a very specific word for water that is only used in this small neighborhood, and it got it. Because we're pulling, again, from a lot of translation engines. And if any of y'all are familiar with the language Haitian Creole, and there being a huge need for it right now because there are absolutely no resources available besides human interpreters, our production team and our product team has been creating our own language model of Haitian Creole. We've been working with a Haitian Creole interpreter. They've fed in thousands of lines of data into our language system to create this new language, and we'll be announcing that soon in spring. So just in the next couple of months, we'll be announcing that. And that will be very exciting. So there are certain languages that it doesn't cover, certain dialects that it doesn't cover, but it's also something that we're trying to work on and innovate ourselves if no language models exist, or pulling from any available resources that we have. Yeah.
Two things. First, I'm assuming that it will show the translation on there as well, not just the voice.
It does if you want. So what it saves is it saves just your physical. I mean, I don't have a little zoom in camera here, but it will save the text and then it'll just read it back
I
out.
hope we can work together to eliminate all language barriers.
You know, that was what I had just said earlier. But it'll save that if you want it to. Now, some healthcare providers are like, absolutely not. I do not want that on the device. I do not want that anywhere. I don't want it to be saved. Because again, anyone who's holding this device, if you had that setting on, can see all of the conversations that I've had in the past, which is, of course, a breach of security if that's how you're using it, to see like multiple different patients. Or of course you could have it wipe after a certain amount of time, like after every hour, or you can manually wipe it as well. Like let's say if one patient holds on to it for the entire stay, their entire journey or their stay, at the end of it you can wipe it. Was your question specifically about that, or?
Well, no, if I'm having a conversation with a patient, instead of them hearing the translation, can they read it?
Yeah, absolutely. Nomás necesitas presionar ese botón y puedo empezar a traducir.
You just need to press that button and I can start
And
translating.
notice you can read it as well, in the Spanish and in the English. Some folks are actually using this device also for hard of hearing patients because they can speak English into the device and then English comes out and you can also read it. A lot of the times people ask, like, can this do sign language? And the answer is no, because it doesn't have like a video interpretation feature, but you could use it for just like text or speech to text and use it that way. Yep.
And my other question is it safe to say that all the questions on this slide are yes to your product?
Great question. Yes. And that in the back, that pamphlet does have all of these questions as well as more questions with our answers. And again, feel free to utilize them. I think when we've been at conferences with some of our competitors in the space, we're like, you know what, just take this questionnaire and go ahead and ask them. See what they come up with. Because as far as all the translation devices in our space, we are the only one that is the level of security that it is, as well as prioritizing enterprise and used for enterprise. Because our space is not the consumer gadgets for travelers. It is for enterprise use. Yes?
Are these available now?
They are available now. They are available now. The only reason I mentioned trials is I know with hospital systems, there's a lot of red tape and a lot of steps it takes. So then the hospital systems need to go through a formal trial and then be able to utilize them. But we also have hospitals and healthcare organizations that are using it all across the country now, currently. You've got my card back there, as well as, like, I think the pamphlets have some emails. And I also have y'all's emails since I scanned you in. So in probably 2 days, you'll hear an email from me, and I'll give you some information as well as additional context for the products. But yeah, they're available now. Some folks, you can get it for B2B discounts if you talk to our sales team, or you can, it is also still available on Amazon if you wanted to check it out there. Yeah. That's a great question. Yeah, a lot of the times you have patients and then they're like already speaking their language and you're like, I don't know what you're saying. So a feature that we have in here, we're working on the auto translation, the auto detection, which would be really exciting when you could just hold it up the device. Not quite there yet because a lot of languages do sound very similar. But what we do have is, I'm so sorry that it's so small, but at the top corner, we have a flags button. And then you could scroll through like, what country might you be visiting from? Or what country are you representing? And then with that flag, it will show the languages that are spoken there, and then they could choose it. And of course, if it's not on there, then that might be a dialect that we don't have available. But yeah, there is that flag feature. Yeah.
Just because I'm in budget season.
Budget season.
Figure out the cost.
Absolutely. $350 at retail price, but additional discounts on top of that for B2B pricing. And I think a lot of the times people are like, oh, that's a lot less than I expected. Within 70 minutes of translation, if I'm remembering that number correctly, on the language line, you can pay for this device. So imagine how many interpretations. We have an ROI calculator on our website, and it's crazy because as you're inputting, like, these are the number of minutes every month that I translate. This is the number of dollars that I pay per month. It shoots out, here's a suggestion on how many devices you might want. Here's your ROI. And it's like 1,000% ROI. It's crazy. And people are like, these numbers aren't real. The reality is these devices are really cheap, and they unlock the translations that you're not having, the conversations that you were just gesturing for, and now you can actually have a conversation. So but again, if we go back to this slide, we're not replacing human interpreters. They are still essential, especially in these really sensitive conversations. But everything else, just use these devices. And it really cuts the cost of like when instead you were just using them for, like, let's say your radiology team, and every single day that's like thousands and thousands and thousands and thousands of dollars. So yeah, as far as cost goes, definitely can cut costs for an organization. Mm-hmm.
Has there ever been a consideration to develop an app that can go on?
That's such a great question. Yes. Yes, if y'all are using like Zebra devices, we're having conversations with certain hardware providers to get our software onto their hardware. Am I allowed to tell you guys that? I think so. Don't tell anybody. But that is something that we're innovating right now, and we're really excited. I think that our ETA on that is by the end of the year. The team is working hard. Yep. Thank y'all so much. Really appreciate all these questions. Stay behind if you have additional questions or if you want to chat more about it. But y'all have a fantastic day in the rest of the conference. Really appreciate it. Thanks, y'all.